Now imagine being pinned to the floor for 18 years by a strange disease that inhibits your growth and the use of your arms and legs. That's the reality of 18-year-old Gideon Kwame Fafa Apenya, who was struck with a spinal condition at 3 months and has not recovered since. I visited Gideon at his home in Peki Avetile in the Volta region. What have you been doing for the past 18 years? I'm sure you've been working or schooling, definitely living and growing. For Gideon, whom we are just about to meet, he spent every single day since he was 3 months old, bedridden with a spinal condition. We're here to meet him and Doris, his mother, whose life has changed dramatically since her son was diagnosed. Gideon lives at Peki Avetile in the Volta region with his mother Doris and grandmother, who is also bedridden. "18 years ago, the 3-month-old baby was crying, eating and sleeping like any other child until things started getting worse.
First one, na me be kind one no tisa. Until no senior or ye na me de who ye say, Bribi ye akolan. Catch my sister, no friend, and I don't call hospital. I don't know, no go share, say, me spinal cord. Inti, free one, or mama, I did say in summer. Now, so yes, I need to be film. Now, ya, just can't. I can say, Scassamutina, young fananco, be seen.
What seemed like a routine illness has kept him in bed since then, preventing him from growing into the man he should have been by now. Caring for him has become a full-time occupation for Doris. She is unable to take up a meaningful job because her son needs her help.
First, I need to make a career job mama for a be a distance, a move trinkakra. Nanso maybe war no 90 centi eya ha me to me nko baby a menye hwi e bia me ko baby a gise kutu no sana obi a friend say obi behwe ma me e bia aha ni haya se me pese me ko echi aja no say nso kom de no onso ana onye sign bia ma obi hu say e bia nso kom de no na se mi ana me hu senior or see meaning native on some macron salmon I can't mean say we here we yes
She sells oranges for a paltry 10 Ghana cedis, which she recoups every 2 weeks.
Yes, one. If you have the donor, if you are 10 cedi, and then back 50 pesos. A down one to them, maybe a while, that comes to say 3 cedi, 4 cedi. A damn man, Yanusana, me, that's right. Then to honor swan. Now, a Beatrice and no why. Niamaton, a beer, and Bradian, and their own.
Her 18-year-old son, who should be graduating from senior high school by now, is unable to walk, talk, or feed himself. He simply did not grow. Though Doris says she no longer feels the grief and despair which greeted the news of Gideon's condition, her tears betray a deeper pain.
Sister na me no boy and me the kind wo Gideon. Ono ni dia na me de won ti de bia sese ni ba no SS2. Gideon wo ono so yo be ma. Nti me hunu sa na me se nka me ba wo SS ana JHS. De bia me hunu na me hunu me size for ma e ha me. And so me ni obi a mekwa akoka me say see me see nti. And be ashamed.
Terry is a social worker at Peki with the Ripple Foundation. He describes the shock he felt when he first met Gideon.
I was able to control myself. It was a big problem to me. So there, and I called our founder outside. I came to find some problem like this. So quickly, she said I should give her some pictures to see. So quickly, I took some pictures, then I sent to her. So that says, no, this one there, she can't even watch because she's even crying. She started crying.
For Doris, there is still hope for her that her life can improve in some way and that Gideon's condition will change. Medical officers say it will be difficult for him to have the semblance of a normal life, but definitely his comfort can be improved. We wait to see what the professionals have to say, but we're hoping that tonight Gideon will sleep in peace. Daniel Daze, JoyNews, Peki. Let's get on the phone lines and talk to the head of social welfare at the Kolebu Teaching Hospital, David Lamte. Mr. Lamte, thanks for joining us. So we've met Gideon. This is someone who had a strange medical condition and his parents could not afford the health
Hello,
care.
sir. Yes, I can hear you now.
Okay, great. Great to have you.
The line is faint. It's very faint, sir.
Great to have you, Mr. Lamte.
Hello?
Can you hear me, Mr. Lamte?
Yes, your line is very faint now, sir.
How is it now?
I'm saying that your line is very faint.
Right. I'm hoping you can hear me now. I'm asking what are the options available to parents when they can't afford the health care for their children?
Yes. So, like, okay, you are calling me on another line. Hello?
Right. Mr. Lamte, we'll try and re-establish contact with David Lamte. He's the head of social welfare at the Kolebu Teaching Hospital. We'll go back to Mr. Lamte later in the bulletin, but in the meantime, officials of Tafo Government Hospital say the treatment of children with COVID-19 is hampered by inadequate space. They say the creation of a separate isolation center for children, though beneficial, has been difficult. Medical Superintendent Dr. Kwame Ajiwan wants urgent steps taken to address the challenge as the citizenry is encouraged to adhere to the safety protocols. Nana Ojima has more.
Established in 1976 for about 4,000 persons, the Tafo Government Hospital is yet to realize any expansion despite increase in population to 300,000. Wards of the hospital are congested with only 5 beds for children. Though statistics are not readily available, a number of children in the municipality have tested positive to COVID-19. Medical Superintendent Dr. Kwame Ajaman fears the system will be overburdened with the surge in COVID-19 cases.
And we deem it necessary to separate the children from the adults. But what happened was that some children in the Tafu municipality started having this illness. And if you look at the place, due to the congestion, it was very difficult. We tried whatever we could to find appropriate structures to take care of the kids, and which we managed to do. But all those were temporary structures we cannot use in the long run. And that was the situation by then. So we were very grateful and happy when the high incidence of the illness went down. But the problem is still imminent. Should this Delta variant catch up with us, we will still have the same old problem.
Behind me is a long abandoned maternity block, 100-bed capacity with a neonatal intensive care unit. When completed, it will have 3 different theaters. But after the era of President John Agyekum-Kufuor, who started the project, it's been long abandoned. Officials of this hospital are worried about the future of the project. Meanwhile, the youth organizer of the New Patriotic Party, Henry Nanabuache, is leading efforts to construct a 28-bed capacity children's ward with a neonatal intensive care unit. He describes the gesture as his birthday gift to the community.
I also walked around the hospital and I noticed that for the children's ward they have, the existing one, we are talking about only 3 beds. And from the medical director, you notice that this hospital serves 34,000 children. So putting up this year is most critical and it's going to serve a lot of people.
For Joy News, Nana Ojima reporting.
We'll come back to COVID-19 in a bit, but let's go and speak to David Lamte, our head of social welfare at Kolebu Teaching Hospital, on the earlier story of Gideon Apenya. Mr. Lamte, if you can hear me, thanks so much for joining us.
Morning.
Yes. So if parents can't afford medical bills for their children, what do they do?
Yes, when such cases come to the hospital and they don't have funds for treatment, what we normally do is that we have what we call the proper form in the hospital that we issue out for them to get the needed assistance to do their investigations and then treatment. So when they are admitted, then of course we also get philanthropists to come on board to assist them. And after discharge, if they cannot pay their bills, of course, we recommend to the hospital to waive all their bills.
So
Yes.
when you hear of a case like Gideon, where his mother went to the hospital, she says they went to the children's hospital 18 years ago, and they couldn't come back for a checkup. So the condition has been with him since then. How do you react to that? Or how does that make you feel?
Well, normally what we do is that we make inquiries as to why they couldn't come back. So when we investigate and know the reason why they couldn't come back, then based on that, we are able to assist them, as I said earlier on. Normally, it's through funds, because most of the time, maybe they don't have the funds to get the needed treatment. And so they go back and then relax without coming back to the hospital. But however, if they are educated and then know that there is such a system as the social welfare unit at the hospital, and they follow up, we are able to help them get the needed treatment.
Okay, so for someone like in the current state that they're in now, it's been 18 years since he received any medical treatment. What are the options available to them now? What can they do today?
Well, Well, the option that Mr. Adela will ask us now is for the patient to get back to the hospital so that the doctors will do the necessary assessment and know as to whether the treatment will have to go on or otherwise.
Right. So can they, for instance, walk into the Kolebu Teaching Hospital tomorrow?
Yes.
Right. Being the head of social welfare there, would your office be willing to follow up on this particular case?
Yes.
Right. We'll be in touch, Mr. Lamte. Thank you so much for joining us this morning. Right, David Dante is head of social welfare at the Kolebu Teaching Hospital. He's encouraging that Gideon seeks professional health care from medical professionals in the shortest possible time. Let's get back to COVID. And President Akufo-Addo has bemoaned the decline in the wearing of face masks in public places. According to him, it is necessary to adhere to all COVID-19 protocols, and the wearing of face masks is not an exception to this rule. In his 26th national address on measures his administration has taken to fight the spread of the virus, the president stated that anyone found flouting this directive will have him or herself to blame. He revealed that the COVID-19 task force, which he chairs, had recommended a second look be taken at the protocols that have been put in place for the holding of funerals and weddings across the country.
It is extremely troubling to note that the high compliance rate with mask wearing has fallen alarmingly. The wearing of masks in public places, fellow Ghanaians, continues to be mandatory. There are no exceptions to this rule, and strict conformity with this protocol will be enforced. Anyone found to be flouting this directive will have him or herself to blame. We cannot afford anyone's recklessness to endanger the lives of the majority of persons in the